Now, the engagement between CGTN Africa and local media houses on information gathering and sharing on the novel coronavirus or COVID-19 is paying off. Local journalists have admitted the cooperation is helping to fight misinformation that can spread unnecessary fear and cause panic. Switch television anchor Nicholas Mudimba says apart from discrimination and stigmatization, misinformation undermines people's willingness to follow legitimate public health advice.
How would you describe the cooperation between CGTN and the local media in terms of providing factual information on the outbreak by engaging local media houses such as yours?
The beauty about it is that now the cooperation or the partnership with the local media means now the Kenyans will be getting factual news. And you see, once we depend so much on international news, that means we're getting conflicting figures, conflicting reports. Now the partnership itself will help now the locals in the country understand the real issues on the ground, because now as CGTN, you have the first-hand information coming from China. So that for me, that means it will be easier for the locals to understand that indeed CGTN says it now through other media houses. That means now we're getting the right information.
CGTN is also facilitating interviews with our correspondents back in Wuhan in China at the epicenter with local media. Do you think that as well goes a long way in creating confidence in how China is trying to control this, and in terms of also doing away with misinformation?
Yeah, sure. I've watched a good story on CGTN about a reporter who went and visited a patient in hospital. That's big. And you see, by having that confidence as a reporter, as a team, to go directly to this affected person, it shows something. It shows that indeed the recovery methods or the recovery kind of ways are really successful. So for me, as CGTN, I can say doing a good job in terms of now publicizing all the situation, from the affected ones to the recovery methods, how they actually taken through recovery. People have died of this. You don't get to see the good stories about the recovery. So for me, CGTN is doing a good job in terms of just making sure that people understand that this thing is being fought in all ways.